your host, Sister Ayla Green. You can find out more about us by logging on to our website at igbattmho.org. Today, I wanted to share some resources with you. A lot of times people are looking for resources and not knowing, exactly where to go. So I want to see if I can share some with you on my screen here, if I'm able to do that. Okay, that's me. So I don't want to share that. I have a lot of things here open. Let me stop sharing here. What I want to do, there are some resources that anytime that you're looking for resources, you're looking for, you have questions, not really sure where you should go. I want to give you a couple of resources that you can kind of write down. Okay, let me see here. I think this is it. Okay. Okay, great. These are some links. This is from our website, igbattmho.org. You can go to our website and we have some links for mental health. We have various links, research, suicide prevention, veterans crisis line, et cetera, et cetera. But what I wanted to show you is start with this one. This is the link that you go to. It's the government website. I like going to the government websites. Okay, you can see me. I like going to the government websites because you know that these are things that are verified. These are things that the websites are appropriate. So that's why I like going to these particular sites. Now you can go to our website at igbattmho.org, or you can go directly to this website, which is findtreatment.gov, and it's part of the SAMHSA website. So when you look at it, it takes you, you find anything that you want here. You can find a treatment facility. You can get help resources. They have the national hotline, disaster distress hotline. So for example, if you wanted to just find treatment, you can put in, and I'm just going to put in, let's say, address in DC. If you don't have an exact address, you can put in just the zip code. But you can put that in and you can do like a search. Okay. All right. And when you search, it will show you the different providers in your particular area. So what I did over here, I'm sorry. So if you come over here, you can put in substance use as well as mental health. If you want to just put mental health, you can do that, and it'll find just the facilities that focus on mental health. Or if you just wanted to do substance use, you can do that as well. But okay, so let's look at just the mental health resources in this particular area. So like I said, what I did, I came here and just put in your location. You put in your location, you hit search, and it gives you a list of various clinics that are located in your area. These are clinics. Again, you can call them and find out, hey, how can I get help? How can I get resources? How can I get services? So this is one thing that this really helpful. So if you are living with a severe and persistent mental illness, you have a family member, a loved one who is living with a severe and persistent mental illness, or if you're a church, a nonprofit, or anyone or who may come in contact with someone who may need help or have some questions, this is a good site. Go ahead and pin this. So again, you can go to our site to get it, or you can go to findtreatment.gov locator. You can go straight to this particular website and you can get the resources. Now, I would encourage you to call maybe a few places, start there and start calling around, because just because they're on the website, there's no guarantee that they have room, that they have, what do you call it, that they have the services that you need. But this kind of gives you a start. So for example, again, you could put in any zip code. I don't know what zip code to. I'm just gonna put one. Okay, I just made this up. This is Cordova, Maryland. Okay, again, you have some places out here in Easton for all seasons. Now, the mental health clinic. It's always a great place. If you don't know where to start, you can start with your behavioral health clinics in your particular area. Every state has a central, some states they call it the Department of Behavioral Health, some states they call it the Department of Mental Health, but every state has a mental health agency for that particular state. You can always go there and they will also kind of give you some resources as well. That's another location, another option for you. Again, you can look at residential facilities, outpatient residential. You can look at the facility types, and they have various different types you can look for. Community mental health centers, certified community behavioral health centers, VAs, medication therapy, just whatever you're looking for. So again, I would encourage you to kind of pin this to your website. Again, we're looking at states. So for example, if you were in the District of Columbia, this would take you to the DC Department of Behavioral Health. And again, mental health agency. Some people use the term, just say mental health agency. Some people say the Department of Behavioral Health. They're the same thing. But again, this will take you straight there. And when you call these numbers, you call them, they will refer you to a provider in your particular area. So again, this is just another option. You can also, you can pick any place. It doesn't really matter. You have Florida, the same thing, substance use agency. So this one website, you don't have to try to kind of figure out where to go. This one website, which is findtreatment.gov, can take you, it has all of the states here. Okay, all of the states, West Virginia, and you notice these are the behavioral health agencies. So again, this, how do you get here? You can go to our website or you can go to findtreatment.gov and make sure, because there are a lot of other locators out there, that when you go to the site, let me make sure you guys are, what you said, great, that when you go to the site, you're looking for the .gov is after it, and then you see the SAMHSA, Substance Abuse and Mental Health Services Administration. So you can come here, you can look for search for treatment, you can go state agencies. So let's do this real quick. You can go to, this is the main site here, which is the samhsa.gov. This is the Substance Abuse and Mental Health Services Administration. This is the federal government's website. You can go here. And then once you're here, you notice it has publications, different, more about the programs, et cetera, et cetera. But over here is where you can find help. So this takes you to the findtreatment.gov website, which is where we were just at. So you have to findtreatment.gov. This is what it looks like. You can put in your zip code. If you know the name of the facility, you can go ahead and do that and just go ahead and do a search. State agencies, these are all, every state has a Department of Mental Health or Behavioral Health agency where you can call. Colorado, okay, Delaware, whatever state you're in, you can go here and you can get a phone number. Every state has an emergency hotline or some type of suicide prevention hotline set up as well. Now let's go back here. Looking at search for treatment. Let's go back to their home page. Okay. At their home page, which again is the SAMHSA, samhsa.gov, you have the findtreatment.gov, and then you have the 988 Suicide and Crisis Lifeline. Okay, oh no, I don't want to do that. Call or text, okay? As you see here, you can call or text 988. If you don't want to do that, and which we're not, we're just going to go to the site. I just want you to see the site. Okay, this is the 988 Suicide and Crisis Lifeline. So, for example, you may not be feeling suicidal at the moment. You may just want to have somebody to talk to. You can also call or text them, and it's 988. It's in all different languages to include Spanish, and they have Anyone could be struggling with suicide. Specific resources below. And they have some specific resources. You can it kind of tells you what happens when you call the 988 lifeline. So again, this is just another resource that you can use. The next thing on here I wanted to show people, you have the disaster distress hotline if you want to call them. Um, and this is specific to a disaster. You know, a lot of times in the United States, we have, hurricanes, tornadoes that impact a large proportion of Americans. You can also call this number. Again, you're undergoing a disaster, you're feeling a little stressed out, overwhelmed. You can call this number as well. Okay, let me go back. And again, you have the national helpline. It's just another option, treatment and referral, and ask you about the different languages you that you may need. So you have that as well. And then we also have the Veterans Hotline. I don't want to make sure I don't want to leave that out. Okay. Again, let me stop here. A lot of people ask about how do we pay for treatment. Okay. So in many states, if we're looking at an emergency, it's just like anything else, there is not a there's no cost, right? You don't want to let not having money keep you from seeking out treatment. What happens is, let's say you don't have any insurance. If you don't have health insurance, some facilities offer free or low cost care, sliding scales fees based on your income, or have payment assistance available. What will happen is, let's say, for example, if you require an inpatient hospital stay, you'll be connected to someone in social work services or case management who will help you look at insurance resources to include Medicaid. Medicaid is for people who don't have any insurance or people who can't afford to pay for it. But don't let not having insurance stop you. Okay. So this is the treatment options, understanding addiction. Now, when we have here, let me just put something in. Okay. Okay, I'm just putting in any zip code. Okay. Now, let's just say you're a veteran. Okay. It takes you straight to the va.gov. For veterans, you are not limited to just the VA. You can also utilize these resources as well. But if you want to, you can go to va.gov, talk to the Veterans Crisis Line now. If you click on that, again, 988 is the number for the United States, like a central, is the main number, like 911. And that's why they set it up. They set it up like a 911, but this is 988. So anytime you can call, veterans can call this number as well. You'd let them know you're a veteran. They'll kind of talk with you through different services. Then there's the Veterans Crisis Line Net. Again, 988, then press 1. It will take you to where you need to be. So again, I wanted to just share these resources to let everybody know that there are resources out there. If you have a phone, you can 988 whoever you are. If you have a phone, you can put in the links in your phone and just kind of get the support and resources kind of that you need. Okay. So again, where did I go? I went to our website, igbattmho.org. If you remember that, you can link from our website, but you can go directly there, which is findtreatment.gov, or you can go to SAMHSA. And I encourage you to do that because with SAMHSA, it's like a lot of different resources. Let me see if that came up. Well, it didn't come up. I'm sorry. Okay. Okay, but if you're here, if you go to the samhsa.gov, you'll see there that particular website, and it'll take you to a lot of different resources. So from findtreatment.gov, remember the .gov, because there are a lot of other websites out there that I definitely wouldn't recommend. They have all types of stuff on their website, but if you start with the .gov, you can't go wrong. You have to find treatment facility. You can put anything in, and when you do, different resources will come up. You also have the like I said, the Veterans Crisis Line that you can kind of go to. Let me see if I can take you there. Mm-mm-mm. Okay, great. So if you're a veteran, this is where you can go. Um, 988, then press 1. So you have that particular website. And what I want to do is to make sure, because I'm not sure people, you were able to see it. So let me stop sharing real quick and share my screen again. Okay. This is the SAMHSA website I was talking about. If you go to this particular website, it will put you where you need to go, because you have the website, samhsa.gov, right? Getting help, which is the findtreatment.gov, the 988, you have the disaster hotline I was talking about. You also have, you know, publications, you can get other information. So again, 988 is the one-stop shop number. Findtreatment.gov, you can go here and you can put in your zip code and you can find resources in your particular area, to include, let me make sure I bring this up here. I'm just going over this again because I'm not sure if everybody was able to see it. Okay. Okay, you're good. Okay. So state agencies here, you put in your particular state, it will take you to the Department of Behavioral Health or a mental health agency in your particular state. Every state has one. Okay. So again, this has been It's Getting Better All the Time Mental Health Outreach, IGBATT number one at AOL.com. You can email us, go into our particular website. I just wanted to make sure that you knew what the resources were, that there are resources out there. Okay. I want to make sure that you know that there's always support. There's no reason why we, will have should have questions and we can't get the answers to our questions. I want to share one more thing with you before I let you go. Okay. And this is our particular website. If you go to our particular and you go to the services, or you can go straight to mental. And if you go straight to mental, you can also get to it. Mental health information, mental health resources will also take you. Let me make sure that's the right one, because I have two of them. Will also take you to places where you can get more information. So again, this has been It's Getting Better All the Time Mental Health Outreach with your host, Sister A. Legree. Just wanted to take a few minutes to share resources with you, because in your particular area, wherever you live, you can get help. Okay, you can get help. So it's Getting Better All the Time Mental Health Outreach with your host, Sister A. Legree. Have a great day. Again, remember 988. Remember SAMHSA. Remember findtreatment.gov.